Now for the latest on the world's race toward a vaccine. Latin America has been devastated by COVID and it now faces its next battle, vaccine distribution. With me now from Sao Paulo is Bloomberg's Brazil country chief, Julia Leite. Julia, it's great to have you back on Quick Take. Throughout the pandemic, Latin America has been one of the more vulnerable regions in the world. So just give us an overview of how countries there are preparing for the vaccine.
Well, thanks for having me. So as it was with the first phase of the pandemic, countries are kind of each taking their own very different measures. One example is Brazil, obviously, which is one of the hotspots in the world and the second most deaths globally from COVID. And what we're seeing so far is pretty much the same thing we saw in the first phase of the pandemic. The federal government has been very slow to respond, very slow to plan. So states are kind of taking into their own hands to plan. So São Paulo, for example, which is the biggest state, the richest state, says it's going to start vaccinating people on January 25th. Now, the vaccine São Paulo bought is China's CoronaVac, which has not yet been approved, and there's no phase 3 testing. So even though we have a timeline, we don't actually have the shot yet.
Wow.
And the federal government itself is relying on Astra, which we've seen over the past few weeks, a lot of issues with the testing, and we don't know the effectiveness yet. And a lot of the region is relying on this specific shot because it's cheaper and it's easier to store and easier to move because of the temperature requirements. I think it's about 40% of the vaccine supplies are expected to come from Astra, and the timeline for that is a little bit up in the air after the latest news out of there.
So I want to stick with Brazil because as you write in the piece, Jair Bolsonaro has said that he will not get a vaccine himself. He has said that masks essentially don't work. All of that said, Brazil has a really good track record when it comes to actually vaccinating for the flu. 90% of the people it intended to vaccinate with the flu shot, this year they were able to vaccinate. It's significantly higher than us here in the United States. Explain the discrepancy there.
We have a very, very strong immunization program. It's been set up for decades. It is very widespread across the country. And Brazil has a very good history of vaccinations, not just flu, but everything, measles, you name it. So we spoke to a dozen health experts here, and they are optimistic that this will go better because the system is so strong. But in the end, what has to happen is the federal government has to buy the supplies to give to the public health system so they can vaccinate, right? The states they can do their own things and they can distribute the vaccines to their states, but you're going to have a huge discrepancy between what's happening in each location, right? If every state buys a different vaccine and distributes it on its own, or if São Paulo starts vaccinating 2 months ahead of the rest of the country, it's not particularly effective to have one state vaccinated and 26 others that are still waiting for 2 more months, right? Are you going to have tourism into São Paulo to get the vaccines in the public health system? And you're still going to have it spreading elsewhere.
Yeah, and the area that you know we're talking about right now has seen some of the worst numbers when it comes to COVID deaths. 30% of the deaths in the world have come from Latin America. Julia, I want to move to Mexico now because the piece that you and your colleagues recently wrote about this opens with this anecdote of hijackers stealing flu vaccinations in the country. What are the hurdles that Mexico faces when trying to vaccinate its population?
You have seen Mexico is in flu season, unlike Brazil, because we're in the southern hemisphere. But it is one concern, and a concern globally, really. But in an area that is already so ripe with crime and lawlessness, like Mexico and Latin America as a whole, the stealing of vaccines is a concern. I think Interpol issued a global warning saying this is going to be a problem this year, right? Yeah. In Mexico, you've seen a lot of issues with COVID as well. They have a huge positivity rate. They're not testing enough, as most of the region is not testing enough. And you also have this situation that the federal government is a bit slow. They have different agreements than Brazil. They have something with Carlos Slim, but again, a lot of it is relying on the AstraZeneca shot.
Bloomberg.
And
go ahead.
We don't know exactly when that's going to happen.
Yeah, certainly still waiting on those dates. Bloomberg's Julia Lacey in Sao Paulo. Julia, we have to leave it there, unfortunately. Thank you, as always, for your time and for joining us on Quick Take today.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.